Hello, buddy. Senior engineer, MBA, and investor. And in today's video, I want to talk about CRISPR Therapeutics. I want to talk about what is next for this company. And of course, this video comes from an inspiration from the latest YouTube comments and also from things I've been seeing on X.com and so on. So a lot of people have been sort of predicting that CRISPR Therapeutics will be bought out sometime in 2024. And I think that is not going to happen. Now, of course, that is my opinion. That is an educated opinion. I don't necessarily think that that this may not be possible. In fact, it is entirely possible that Vertex comes in and says, you know what, we don't want to just invest in your programs. We just want to flat out buy you at a premium, let's say 150% or 200% from your current stock price, which would actually put them at their peak, which was in 2021. So anyone that's bought CRISPR Therapeutics at their peak probably gets a break even if Vertex, for example, comes in and buy it at a huge premium, which I think will be necessary for a company like CRISPR Therapeutics at this moment. Like right now, everything is going really, really well for them. They just got the FDA approved their sickle cell disease. It's expected that the FDA also approves the beta thalassemia side of that program for Casgevy. And of course, the UK government has approved CRISPR Therapeutics and Vertex program as well, and Bahrain. And then we have more countries looking into it. We know this for a fact, and we expect other countries to approve it, which was actually one of our predictions in yesterday's video. Now, in today's video, though, I want to talk about, what is their next for this company, right? I want to specifically focus on CRISPR Therapeutics. So this article here on Seeking Alpha basically goes over that topic and says that CTX110 will most likely not be the next program that gets approved. And actually, you don't really need this article to tell you that. If you reviewed our video months ago, you would know it was the case. In fact, CTX110, CRISPR Therapeutics sort of stopped giving any sort of data for a while. They started shifting towards what they call 131, for example, or in this case, 112. And the reason why they shifted that is probably because the data from 110 was not sufficient. You see, these companies go through these clinical trials to essentially determine what is the probability rate that this program may get approved by the FDA. And the FDA is just one regulatory body. Obviously, there are other regulatory bodies in different regions, but the FDA is obviously the biggest one, the biggest fish in the sea there. And of course, like here in this article, I don't know how factual this is. I'm quoting here, says, however, even global data gave the product a relatively thin chance of eventually reaching the market, saying it had less than 50-50 odds of making phase 3 trial and only 31% chance of approval. So 31 chance of approval is pretty low. Like for a company that's going to pour billions and that's going to wait a few more years, I think it doesn't make sense for them to stick their guns to 110. And again, I want to remind viewers, 110 is really the big fish in terms of what it is able to do for the company, because it's all about CAR T cells. And CAR T cells, basically, if you can crack the whole CAR T cell enigma, you can basically tackle cancers, various types of cancer. So we're looking at leukemia and so on. And of course, the whole point of 110, whatever technology they're using, whatever specific edit, whatever it's doing, it's basically going to make the CAR T cells be durable, so last longer. So basically, you have healthy cells last longer to combat the cancer cells in the patient's body, and therefore reduce the cancer impact and obviously potentially cure them in the long term. So that's the whole point of 110. Now, unfortunately, like I said, data hasn't been so good. I mean, I've reviewed data a couple of years ago, and even months ago, I reviewed the last set of data that they had published, and it wasn't that bad, but it was basically average. Some may argue it may even be a little bit below average. And at that point, I think CRISPR Therapeutics as a company, you got to remember they have a successful program into Casgevy, or CTX11001, it was previously called, right? And I think what they're looking at is, look, we have such a success with CRISPR-Cas9 ex vivo in that particular rare disease, blood disorder, whether that's sickle cell disease or beta thalassemia. We can't just be, half-assing it in the CAR-T space. And what they're doing now is shifting towards another iteration. And I truly believe that there's something to be said here. I think CRISPR Therapeutics are going to double down on CAR-T space. I think they're going to double down on that. There's like a dark horse in all of this. I don't think it's the heart disease one. I think that's way too early with their in vivo. I think it's their diabetes. I think we have yet to get any sort of reasonable data from their refreshed program with ViaCyte, which is, of course, owned by Vertex now. So if you remember, like a couple of years ago at this point, it's like 2 years ago, they had announced with the ViaCyte, at the time they were not owned by Vertex, that they were dosing their first patient. We never got data from that. A lot of experts in this field expected that the data was insufficient or not that good in Canada. Of course, they were dosing patients in the west side of Canada. So Health Canada gave the green light for that program. So obviously they gave also the green light for the next iteration of the program they're working with ViaCyte, which now is owned by Vertex at that point. And I think we'll get some data at some point in 2024 for that. We have to, or else I just don't see where this initiative is going with the diabetes side. I think it's a huge market, type 1 diabetes. Whether that's for type 1 or type 2, I think it's a huge market. I think it's going to get a lot of eyeballs. I think it's going to get a lot of investors involved in this space, especially the institutions, when you talk about these types of, whether it's cancers or, diabetes. These are big things. Now, don't get me wrong. Sickle cell disease and rare blood disorders are very important to tackle. It obviously gets a lot of traction, as we saw from mainstream, from Saturday Night Live, all the way to like channels from popular social media channels like Value Entertainment. So don't get me wrong, there's a huge market for that. But when you start talking about diabetes and cancers, now you're going to the next level. And I think CRISPR Therapeutics are focusing on that. So whether that's cancers or diabetes, I think that's what's their next program they're willing to bet on. You got to remember that Vertex owns 60% of Casgevy. So if anything, Vertex is spearheading the whole commercialization of that program. So at that point, it's CRISPR Therapeutics' job is done with Casgevy, or Hexacell, or CTX001 as it was previously called, and now their focus is shifting towards, of course, CAR-T space, and of course the diabetes, and potentially even the heart disease side that they're trying to tackle with in vivo, which again, it's way too early for us to predict. I don't suspect anything for 2024 for that program, but I do expect stuff with the CAR-T space. I do expect stuff with the diabetes that they're working with ViaCyte, which again owned by Vertex now. So lots of interesting things happening with this company. And then the big question is, will they be bought out? I mean, I don't think it's happening. I think Dr. Sam, CEO of the company, has mentioned multiple times that he expects CRISPR Therapeutics to hit, $25+ billion market cap. And it's nowhere near at this point. They would have to like 5x at this point to get there. I don't expect them to be bought out, but if they do get bought out, I don't expect them to be bought out at less than $20 to $25 billion market cap, which again would beat their peak back in 2021. So every investor will be rewarded, even those who bought at the peak and are backholding basically, right? So we'll see what happens. It's sort of a hit and miss at that point with that prediction, whether or not they'll be bought out. But man, I do. There's a side of me that don't want them to be bought out, because I just really want to see them play out this. I just really want to see this play out for them. I think it's an amazing company with a lot of potential. They're doing something that no other company in the stock market is doing, and I think it's something noble. I think it's something to be said there, and to stay independent as a company and see your full potential. I think there's something to be said. But again, we all know the story as to why companies want to sell to maybe bigger companies, get more funding, reward early investors, basically put less stress on the company. And obviously you need that investment, that huge fund, if you want to develop multiple programs. But there's different ways to skin this cat. So we'll see where we go from there. So as always, guys, subscribe if you're not. Like this video, please do like it. It really does help the channel. Let me know, guys, what do you guys think is next for CRISPR Therapeutics? What do you guys think about the CAR-T space, diabetes side, or do you guys think this company gets bought out this year? Let me know. Curious to see what you guys think. I'll see you guys in the next video. Thank you.